Hi, I'm Dr. Alvarez with Endobariatric.com, and welcome to another episode of our FAQ section. Today we will be talking about IV therapy after surgery, and this is more and more common nowadays. It wasn't so much back in the old days, but today seems like it's been a trend to have IV therapy bars or IV therapy lounges or IV therapy. They give it so many names. So what are these IV therapy bars? Well, actually, it's IV fluids that are ideally designed for the patient's needs, to give you IV fluids, to give you vitamins, to give you certain medications or a certain treatment. It could be at a IV therapy lounge or bar. That means it's an establishment that is designed and designated for this. Or nowadays there's even IV therapy like mobile solutions. They'll go to your it'll be like a home delivery, and they'll go to your address and give you your IV therapy. It's normally nurses that will hook you up on an IV and give you a certain treatment or IV fluids. So coming back to the question, do you need IV therapy after surgery? The answer is no. Vast majority of patients don't need anything of this. Would you find this useful? Yes. But it is not necessary. Normally, IV therapy bars or IV therapy services, let's call it this, IV therapy services, they're mainly available in major cities across the United States. So number one, check if it's available once you're home. Two, do you need it? Do you absolutely need it? No. But if you are in a situation that you're dehydrated, if you are in a situation that you have nausea and vomiting, number one, contact your doctor, your surgeon, to get you back on track. And then ask him, do you think you find this useful for me? He'll say yes, all right? Because having a bag or two of IV fluids, yes, it'll pick you up greatly. You'll feel much better. They can give you a certain amount of vitamins, or certain vitamins, especially vitamin B complex, which is crucial at that point. But again, touch base with your doctor to help you out figure out this is right for you at that specific moment. Back to the question: do you need IV therapy, or IV therapy bar, or lounge, or services after your surgery? The answer is no. Would you find this useful in a certain situation like the one I was telling you about? The answer is yes, but first, touch base with your surgeon. I hope you find this information useful. If you did, leave me one of these. It'll be of great support to the channel. And if you want to hang around with me more, go ahead and subscribe. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.